Hi everyone, welcome back to the Hepatitis Fighters YouTube channel. I'm Randall Handel, patient advocate. I'm with Associate Professor of Hepatology, Dr. Faiz Kondakar, and we're going to do a little patient and doctor question and answers. Here we go. Hi Faiz, thank you for doing this again. It's really appreciated to give patients as much detailed information so they understand all the terminology and things behind what can be quite confusing at the start, especially when you get diagnosed with hepatitis B. So what I wanted to ask I wanted to ask you about acute hepatitis B. I understand it's self-resolving, and in most cases within 6 months the patient will seroconvert and develop surface antibodies and become immune. But what I wanted to touch on as well is not only maybe the best way to handle an acute infection, and also when does an acute infection potentially become dangerous as well? Because I think it would be useful for patients to maybe know what red flags to look out for as well, and also what to do in terms of if you've got an acute infection. Thanks.
Thank you, Randall. Acute hepatitis due to hepatitis B virus is a self-limiting disease like many other viral disease. You have rightly mentioned it. It results in 95 to 98% cases within a period of 3 to 4 weeks. We treat most of the patients as OPD cases, that is, they don't require hospitalization in most of the cases. The principle of treatment is supportive or symptomatic treatment, adequate rest, maintaining nutrition and hydration, and counseling regarding the disease and follow-up. Regarding symptomatic treatment, if I want to say that if patient has got any symptoms, and in this stage, nausea, vomiting, loss of appetite is very much common. So we try to improve these conditions by giving some medications like prokinetic drugs, domperidone, antiemetic drugs. And also if the patient develops any constipation, we try to relieve it by giving lactulose, etc. Regarding rest is very important here. We ask the patient to stop going office, school, colleges and shops and to stay at home until he or she is clinically and biochemically, liver function tests get significantly improved. Regarding diet and drinks, there are many misconceptions prevail in many countries among people of different classes. If you have got jaundice, take maximum amount of carbohydrate, don't take other type of food. Take excess sugar water, sugar cane juice, Dove water, as much as you can. Also, you shouldn't eat food which contain spice or particularly turmeric. But these are not scientifically based conceptions. So what is ideal is, or evidence-based medicine says, if a patient has got acute hepatitis, he can take food of all types. That is, his food or diet should contain carbohydrate, protein and fat as well, just like as he used to take before he got sick. Because at this time appetite is poor, so most of the patients cannot take adequately, that's true. So advise the patient to take food in a small amount and frequently, so that he can maintain his nutrition properly. But this is preferable that you shouldn't take junk food, street food or food with high fat content, because sometimes this type of food can produce discomfort in abdomen. And regarding fluids, and healthy adults or the patient with acute hepatitis need to take 2.5 to 3 liter fluids per day. And if he or she wishes to drink juices, tap water or other fluids I have mentioned, he or she can take, but that should be in moderation, not in excess. Counseling is very important, which most often we the physicians forget to do adequately. And the counseling should be regarding, we should make the patient understand what is the disease, how long this disease can persist, and very important is that the initial 1 or 2 weeks jaundice may get rise, which most often, if not adequately counseled, patients get worried. And also we should counsel the patient regarding some danger sign or red signs, as you have asked me, because 2 to 3% cases can complicate it to acute liver failure. Therefore, the red signs should be we should make the patients understand very well. Number one is excess vomiting, which hampers patients taking adequate diet and fluids. This is one. Number two, if patients develops any confusion, disorientation, or sleep rhythm is altered, or if the patient develops drowsiness or excess sleepiness, these are the very danger signs. And also some biochemical change, like if serum bilirubin gets too high, if it is more than 15 milligram per deciliter, if prothrombin time, a liver function test which indicates synthetic function of liver, if it gets rise to more than 5 seconds than the control. So these are the signs, rare signs, and if patients develop such symptoms and biochemical alteration, we ask the patient to consult with the physician immediately, and we admit the patient in hospital and treat them accordingly. We observe them very meticulously. So in this way, most of the patients get completely cured. He or she needs 2 to 3 follow-ups in most of the times. By this time, patients' clinical symptoms improve. Biochemical parameter bilirubin, ALT gets improved. They get completely normal. But what is important to know here is hepatitis B surface antigen, that is HBsAg, indicative of hepatitis B infection, that can remain in blood for a longer time. Therefore, it should not be, we ask the patient not to forget to come for follow-up with HBsAg at 3 months interval. And if it is still positive, then we ask the patient to repeat the test after 6 months. And if it is positive after 6 months, then actually the patient probably has developed chronic hepatitis B, and we counsel the patient for chronic hepatitis B follow-up, and we treat the patient accordingly. So this is how we treat acute hepatitis B patients and counsel them, and what are the danger signs, as you have asked. Thank you.
Thank you for that, Faiz. So my takeaway from that really is, in terms of testing, it's important to do the surface antigen test at the beginning, HBsAg at the start. Do it at 3 months after. If it's not negative after 3 months, then do it 6 months after. And if it's not negative after 6 months, that means the patient has developed a chronic infection. But as you said, 95 to 98% of acute infections are self-resolving. Really, thank you so much for that information, Faiz. That was really, really appreciated, and as ever, very educating as well. Thank you. And thank you everyone for listening. Please do click like, view, and share this video as much as you can. If you have any comments or questions, please write them in the comments and questions box below. Thanks very much, everyone. Take care. Goodbye.